everyone, my name is Dr. Caroline Grady. I'm a physical therapist at Cornerstone PT. Today I'm going to go into a little bit of detail about how the hip and the knee frequently play together and is normally addressed in physical therapy if you're coming in for knee pain. So I'm going to talk a little bit about how the knee is affected by the hip and then show you some common deviations that we see that might be contributing to your pain. As always, when you come in for physical therapy, we do a thorough assessment to understand, in your particular case, what's going on and how we can start to help. So the knee is essentially a basic hinge joint. The bulk of what it does is it bends and it straightens, okay? It can't do a whole lot else. It has small amounts of movement into rotation and into some varus and valgus, which are different forces to the side. However, the bulk of the knee movement comes from pure bending it and then extending the knee. So the hip, on the other hand, has much more freedom of movement. It can move forward, backwards, out to the side, and rotate. I'm going to kind of show some of that. When you are standing, those motions can frequently affect the knee joint. So as the hip can move forward and backwards, can also move out to the side, as well as rotate in and out, all right? So the way that affects the knee is that when your knee is on a surface, or when your foot's on a surface, if the hip is not doing its part to help stabilize the joint, the knee frequently gets into these odd positions that don't have the structural integrity and structural to support large amount of forces in that way. Frequently what we see is that we'll see more hip movement to the side and see the hips compensate for what the knee's doing, okay? So that could look like when you're standing or walking, you get hip drop out to the side. That can put more stress onto one knee joint or the other. Or if your foot's on the ground, then that might cause the knee to dive in. That position is what we call valgus, and so it's the angle of almost that knock-knee angle. So your knees are coming together in that position. I'll just stand on this little stool. Your knees are coming together, and they're not lined up from the hips to the knees to the feet. And that force can create pain at the knee joint. Frequent movements that can irritate it when the hip starts to play a role in the knee. Stuff like going up and down stairs, walking, getting up and down from a chair, and then also looking at some more functional gym type activities, knee pain with squatting, or knee pain with jumping or landing. So those are all motions that require a lot of hip stability and hip support. The primary muscles that do that, there's a couple. One is called your gluteus medius, and it's kind of right on the side of the hip joint. So there's one on each side. Anytime you're standing on one leg, that muscle is working to make so your hip doesn't drop or so the knee doesn't move, okay? So we do that all the time. Anytime we're walking, to keep the hips level, we have to be using your gluteus medius as well as some of the other hip rotators, some of which are piriformis, as well as a smaller group of muscles that help support the hip joint in that standing position as well. Some common exercises that we do for that, common PT ones you might see are something called clamshells. There's also some where you're walking side to side with a band around your knees or your feet, and that's going to help to strengthen the sides of the hips as well. And then the other one I want to show you is one of the best ones to work on it is just squatting, getting up and down from a chair. I'm going to move back just so you can see me here. So if I'm getting up and down from a chair, you want to try to keep your hips, knees, and feet all in a straight line as you're standing up, okay? Now if I'm standing up and my knees are driving inward, I'm not using my hip muscles to keep that alignment to allow those joints to function properly, okay? So one thing to be aware of, especially if you're suffering from knee pain, is to try to think about getting up from a chair. You're applying a gentle force, pushing your knees outward. That way, hips, knees, and feet are going to stay in a straighter line to create less additional movement at the joint. So those are some things that we might look at if you come in for PT evaluation, how other joints are potentially affecting the pain that you're having, either at your knee or hip. These muscles are also really important as well if you're experiencing back pain. So we spend a lot of time strengthening those muscles, and we'd be happy to discuss any of those further with you. If you have any questions, please, you can put your email in the comments, and we can either get back to you regarding those questions or get in touch with you to schedule an evaluation here. All right, it was good to talk to you today.